within our healthcare delivery system. The concern we have when we talk about face coverings and masks is people run to get the N95s, or they run to get the surgical masks, of which we are procuring tens of millions of surgical masks at the same time. And so we want to be cautious in this space. We want to be guided by science. And I'll just say this respectfully, science is a bit incomplete in this space. A lot of people are promoting face coverings and masks. Others caution that it is not a substitute for physical distancing, which it is not, and that it could create a sense that it is and may reduce the protocols that have worked so effectively so far here in the state of California. But know that we are looking to put out guidance on this. We'll put out our recommendations in short order as it relates to face coverings, and those recommendations will include the principal obligation we all have to continue our physical distancing, our social distancing, to wash our hands, and if we are putting face coverings on, we'll lay out guidelines in specific terms of what that means and what it doesn't mean. The last thing we want are people putting on coverings and moving them in their hands, not washing their hands, and potentially creating additional issues, people getting the wrong kind of impression that somehow now they're absolutely immune from contracting the virus and the like. But I know that this is becoming a major issue all across the United States. CDC has implied they'll be putting out some guidelines. I know the President himself and others have made reference to the same. We get this question all the time. When you go to a grocery store, people are trying to practice appropriate physical distancing. You feel like you're not necessarily capable of doing that in a short queue. The appropriateness of having these masks or a version of face covering. We recognize that anxiety, and we want to meet that in terms of recommending specific strategies. And so expect in the next 24 or so hours that the state of California will put out more prescriptive guidelines in that space. We also are very proud here in California. We had incredible leadership that is demonstrable in the state by Cesar Chavez. That leadership was recognized formally as this day is every year, Cesar Chavez Day. And in the spirit of contribution, the spirit of service, in the spirit of meeting this moment, we are also announcing an effort to do more and do better to protect our seniors in the state of California. We have 5.3 million Californians that are 65 years and older. And we've been doing some remarkable things at the local level to check in on our seniors, wellness checks to make sure they're getting their medications, making sure they're getting their prescriptions. But we need to step things up significantly, and that's what we are announcing here today, a statewide initiative.
All right, we're going to pull away from the State Operations Center in Sacramento and take you live now to Santa Clara County. And the person speaking is James Williams. He is the counsel for the County of Santa Clara. He's joined by others in the county who will give us an update on the county's response to COVID-19. Let's listen in.
County Health Officer, Supervisor Cindy Chavez, President of the Board of Supervisors, Sam Liccardo, Mayor of the City of San Jose, District Attorney Jeff Rosen. We're also joined by the County Executive, Dr. Jeff Smith. And I also want to acknowledge our other members of the Board of Supervisors, Supervisor Dave Cortese, Supervisor Joe Simidian, Supervisor Mike Wasserman, and Supervisor Susan Ellenberg, who are abiding by the shelter-in-place order and so are listening remotely. I'm now going to turn it over to Dr. Sarah Cody, County Health Officer.
Good afternoon. Again, my name is Dr. Sarah Cody. I'm the Public Health Officer for the County of Santa Clara. And thank you for being here, and thank you for keeping your distance as well. In unison with fellow health officers around the Bay Area, today I'm announcing an update to my previous shelter-in-place order. As James Williams will detail after this, my updated order both extends the shelter-in-place through May 3rd, as well as adds additional restrictions. I want to be very clear about the overall goal we are trying to achieve. The goal is to decrease to the greatest extent possible the average number of contacts that each of us has with each other every day. So please remember, every unnecessary contact with another person increases the chance that the virus may spread from one person to another. Every revision in the order is guided by that overarching goal, and I want every person living in our county to understand that. We now know that people who do not show symptoms or who show only very mild symptoms can still spread the virus to others. So continuing to stay physically separate, to stay in small, stable groups, and to mix with each other only when necessary is vitally important. Since my previous order took effect on March 7th, just a bit over 2 weeks ago, and I know in COVID time it feels like about a year ago, we've seen our county's case count increase from 138 to 890. And deaths among people living in our county have risen from 3 to 30. Santa Clara County remains the epicenter of this outbreak in the Bay Area. We have some early indications, though, that the actions we have collectively taken are beginning to slow the spread. The sacrifices that everyone has made have given our hospitals valuable time to prepare for the expected influx of patients. However, more time and additional restrictions are needed to slow the spread and to further reduce the impact on our local hospitals and healthcare providers. Our hospitals are beginning to fill with COVID-19 patients. They need more time. We need to do even more to give our healthcare facilities and providers every advantage we can so they can care for us when we need them, whether for COVID-19 or for any other acute healthcare need. This order, like the last, was crafted to balance the public health imperative to ensure social distancing with the need to preserve basic infrastructure and essential services to maintain our society. I recognize that this order and the previous one are creating social and economic disruption for everyone and extreme hardship for many. This pandemic has radically changed our lives. We are each doing the very best that we can, and if each of us keep doing our very best, if we stay the course, we will save lives. People have shown extraordinary compassion and strength. We all must continue to do our part to slow the spread of disease, to ensure that our essential services remain open, most especially our hospitals and healthcare facilities. Thank you.
I want to acknowledge the incredible cooperation and collaboration on the part of health officers from across the Bay Area's largest jurisdictions, Alameda, Berkeley, Contra Costa, Marin, San Francisco, and San Mateo, who by working together are keeping our broader community safe and ensuring a consistent set of orders for our region. I want to take just a quick minute to talk about some of the key items that have changed in the new order that was issued today. First, the order has been extended through May 3rd, as Dr. Cody mentioned. Some of the other key points are that social distancing is now mandatory when performing essential activities or operating essential businesses. And to further enhance that, there is now a requirement that essential businesses must complete, post, and implement a social distancing protocol based on a form that is being provided on the website. This will help ensure that even those places that do need to remain open are adhering to careful guidelines and thoughtful guidelines specific to their own facility to ensure and maximize social distancing. Essential businesses now must also scale down any non-essential components. There were some challenges previously where an essential business had other arms that were doing non-essential activities remaining open. Playgrounds and other related facilities are closed. Many of those have already closed, but this order clarifies that they are to be closed. And most construction is now prohibited with some narrow exceptions. The order also makes a number of clarifications that in part incorporate and reflect the guidance that has been provided over the last 2 weeks on our FAQs on our website. All these materials are available on the Public Health Department's website, including the order, a downloadable social distancing protocol form for essential businesses, a detailed summary of changes, and a set of updated FAQs. Now I'm going to turn it over to Supervisor Cindy Chavez, President of the Board of Supervisors.
Thank you. First, let me begin by saying a very significant thank you. We've been talking a lot about frontline workers, and in many respects, we understand that to be doctors and nurses. I want to also talk about the respiratory therapists, the people who are cleaning the rooms, your grocery clerk, the people who are delivering the truckers who are delivering groceries, the folks who are making sure that water and sewer are still provided. I say that because every single one of these people, as they do their jobs, right now we know are risking their lives. And I say that because we know that this is a highly contagious disease, and what we're asking of all of you is to make sure that you stay at home, that you lessen the number of times you go to the grocery store, and that if you're out, go for a walk, take your dog for a walk, go with your family out to walk. But let's be really mindful that every interaction we have with another person could put them at risk, it could put your families at risk. Let me also mention this. You know, I have been receiving a lot of emails about the hardships that people are experiencing. I first want to extend my deepest condolence to every person who lost a loved one in our community and across the nation. And for every person who's in the hospital right now that can't be comforted by somebody else because it's too infectious and too dangerous, these are really painful times, and we have families that are feeling this very deeply. And I do want to share my compassion with them, and just to say to all of you that we don't want any of your families to be experiencing this either, which is why we're making the changes in the rules that we are. And let me just close with this thought. This is taking a team effort, and I've been thinking a lot about teams lately as I'm thinking about the folks who are working in the hospital, the folks on the front lines working in our EOCs. But every family, every one of you who are sheltering in place are part of the same team, and that team is to make sure the community stays as healthy and as vibrant as it can stay. And the sooner we stay in our homes, the better we adhere to what Dr. Cody is asking us, really not asking us, but demanding us to do, the more lives we're going to save, and the sooner I think we're going to be back to our old lives again. I also just, in closing, Dr. Cody's been, I told her this earlier, that I think that God listens to certain people more than others, and so I've asked my mom to pray for Dr. Cody, and for those of you who believe you have a connection, let's do the same for Dr. Cody and all the frontline workers that are really fighting this virus. Thank you.
Now hear from Sam Liccardo, Mayor of the City of San Jose.
I'd like to begin by sharing with President Chavez my immense gratitude to all those who are working without much sleep, working long hours on the front lines, our healthcare workers, our first responders, many folks who are involved with great nonprofits like Second Harvest Food Bank, who are helping to provide food and essential critical supports for our community during this time of extreme hardship. And this is a time of hardship, and it's a time of shared sacrifice. To be sure, as we are, and my city team will be working hard over the next several hours to understand how best to implement these new regulations, as we are all doing our best to catch up to the fast-changing realities of this pandemic. We are committed to enforcing the regulations of our health authorities to ensure that this shared sacrifice happens now, because we cannot afford to simply hope we can impose these regulations weeks from now. This is the moment when it counts the most to save lives. Weeks from now, we will only have regretted that we did not move sooner. And so it's important for all of us to recognize that there will be more hardship as a result of tighter regulations. There will, of course, be all the hardship that so many have encountered already. We know we've got thousands of families right now that are struggling without a paycheck. And so this is a moment where we have an opportunity as a community to come together to recognize this moment of shared sacrifice, where we can give of our time, of our energy, in any way we can. I encourage everyone to go online, SiliconValleyStrong.org, to please give and give generously if you are able to. We have many families, as we all know, who are struggling without a paycheck right now. And through a constellation of nonprofits led by Destination Home and Sacred Heart Community Services, we are ensuring as many families as possible can get these dollars directly to help them pay for food, rent, and basic necessities. And we also have, if you have a passion for small businesses or nonprofits, we have ways to give to those organizations as well. We also have opportunities for folks who want to donate their time in partnership with the nonprofits who are out there serving our community, obviously abiding by the county's mandate for physical separation. Physical separation does not mean social isolation. This is a time for our community to embrace shared sacrifice, to embrace this moment, because it is in this moment that I think we will find our character as a community, how we can move together to address the pain that so many of us share, and to be able to walk proudly through this very difficult moment, be able to say we did it together. Thank you all for your collaboration.
And we will now hear from District Attorney Jeff Rosen.
I would like to talk directly to the business owners of Santa Clara County who have closed. Thank you. You've made a great sacrifice. You are saving lives. We may never know how many or who. It is very hard to it's very often hard to measure the result of a good deed. Your good deed, your sacrifice, your civic duty will be measured in lives. Someone's grandfather, someone's mother, someone's child will survive this pandemic because you've done the right thing. Those are the stakes. And for the vast majority of you, you have shown over the last few weeks the importance of this great challenge. To those very, very small number of non-essential businesses who have remained open during the pandemic, please close your doors. Please close your doors. Every person who enters your business carries the potential of spreading the virus and endangering more lives. Please join the rest of our community, the vast, vast majority of our businesses, as we stand together through these difficult days. My office, like the police departments in this county, like all of our justice partners, are working hard every single day to keep our community safe. Crime may be down in certain cases, but it has not stopped. We have made extraordinary efforts to safely bring the jail population to a point where we are protecting both the inmates and the public. For the first time, we're holding many court hearings remotely by video, and we're working to protect vulnerable people in our community from crime. We put out warnings about price gouging and virus-related scams. Just yesterday, we released a video public service announcement discouraging hate crimes that have been sparked because of this pandemic. While there are many issues to work out, we know this is not over by a long shot. The good news is that Santa Clara County is washing their hands, social distancing, staying home as much as possible, and following the law. Your actions are saving lives. Thank you.
And we also now hear from the County Executive, Dr. Jeff Smith.
Thank you. So as Dr. Cody pointed out, the main issue here is to try to flatten the curve, so to speak, make sure that the capacity and ability for our health system to deal with the very critically ill COVID patients and our other patients is preserved. We know that 80% of individuals who contract the virus will have minimal or mild effects. But we know that the 20% who have severe effects have very severe effects. So I wanted to let you know a little bit about what's going on right now to surge our health system in this county. We have 11 hospitals, all of which have surge plans in place, all of which are focusing on making sure they have as many ventilators as possible, trying to reorganize their physical structure so that they can expand their ICU beds, looking at how they can increase the number of staff, doctors, nurses, ancillary staff, lab staff, and they're making significant progress. In addition to that, we have been able to obtain a federal medical station, which is now up in the Santa Clara Conference Center and should be starting to see patients on Monday. This medical center station will be available for only COVID patients who don't need acute care hospitalization but for whatever reason still need some services. The idea being here that we will move them out of the hospitals, all 11 hospitals in the county, and therefore make more space. That being said, we're still requesting and ordering supplies from both the state and the feds and the private sector. And we have, at this point, anticipated well over 500 new ventilators coming to the county as a whole for all hospitals, not just county hospitals. But to give you a little bit of insight into where we stand right now, and the numbers I'm going to give you come from yesterday, and you're going to all wonder how come we don't have all these numbers constantly. It has to do with the difficulty of collecting numbers from many institutions who are all private institutions, but we're working on having some of this on our regular dashboard. But in the hospitals, all 11 hospitals right now, there are 152 confirmed COVID patients, another 90 who are suspected of having COVID. We have a capacity in terms of number of beds of 1,475. We have available in all the hospitals 611 ventilators. Only 209 of them are used at this point, so we have 400 available to be used. We have 300 ICU beds total and available right now, 119 total, and in the ICU 56 COVID patients, again, all 11 hospitals. So at this point, we're not near capacity, but we're getting prepared for capacity. I just want to talk a little bit about capacity in health systems. Capacity in a health system is quasi-elastic, meaning it's not like filling up a glass of water where you get to the top and you're done and it overflows. It's more like filling up a water balloon where there's some flexibility because the type of beds available in hospitals change, the type of care given changes, the availability of resources changes. As we get more experience in the health system with this particular disease, you'll see the type of interventions change. Things like ECMO or extracorporeal oxygenation will start to be used more often, which is a way of bypassing lung problems and putting oxygen directly into the blood. So it's not like you're going to reach a capacity and then you're done. But at some point, the water balloon does break. So our job right now is to get as many resources and as many ventilators and as much space in our hospital and health system as possible to be ready for the inevitable problems that will come our way. With this health order, or public health order, we started 2 weeks ago. We know that the incubation time period for COVID is about 2 weeks. So we really expect to have more data, more understanding, more flexibility in another 2 weeks, because we'll have the people who got exposed and contracted the virus 2 weeks ago will now be getting ill, and we'll be able to see how that affects the health system. Also, we'll be able to see more clearly how social distancing works. But we know from experience around the world, particularly in China and Singapore and South Korea and others, that social distancing is the only thing that works to prevent contracting the disease. As Dr. Cody mentioned, the fewer contacts that we all have with others, the better off we are, because the more we reduce the ability to transmit the disease. So everybody should practice social distancing, follow the public health orders, make sure that you understand that Dr. Cody and her entire team and all the other public health directors and their entire team are experts. They know epidemiology, they know public health transmissions, they spent their entire career working with infectious diseases, they know how to deal with these pandemics. They're giving us the best, most up-to-date, most important information possible, so follow it. Thank you.
Thank you, Dr. Smith. David Campos, Deputy County Executive. Before we take questions, we want to note a couple of things. We have in this county a very diverse population. 40% of our residents are foreign-born, so we are making sure that information is given in different languages. There are summary pages of the order that have been translated into Spanish, Vietnamese, Chinese, and Tagalog. Those documents will be going up on our website very shortly, and we will have full translations of the order in the very near future. The second point on that is that we have speakers in Spanish, Vietnamese, and Chinese available to do interviews following the press conference to make sure that our monolingual communities get the information they need. And then lastly, that starting tomorrow at 10 a.m., there will be a daily briefing Monday through Friday that will be done by the County of Santa Clara. So with that, if we can begin with questions for Dr. Cody. Yes, sir.
Dr. Cody, you mentioned some positive signs. Can you describe what those positive signs are? And where are we with the cases? Are we still climbing, or are we starting to?
Thank you for the question. So we have, challenges left, right, and center in maintaining our situational awareness with so much going on. And I won't get into the details of the data, but what I can say is, one, if you look at the dashboard, we now have a dashboard on our webpage so that everyone can track along with us. It shows the number of new cases that are reported every day, as well as the cumulative. You'll notice that the number of new cases are kind of bouncing around a lot. That has partly to do with what's happening and partly to do with how the cases come in. What I can tell you, though, is that once we account for all those variations, maybe in the last day or two, we think we're seeing a little bit of a slowing. I mean, I say that very, very, very cautiously. It's really, really early. And as Dr. Smith mentioned, it's going to take us more time to see the impact of the social distancing. We're working with, collaborating with everyone we can think of in our county, the academic sector, the tech sector, everyone we can bring in. They're helping us, they're eager to help us really understand what our trends look like. So I want to say that the incredible sacrifice that everyone has made, I believe it is starting to bend the curve. But it's not enough, and it hasn't been in place for long enough. And so we need to keep at it. We just need to keep at it. I believe that it's beginning to make a difference, and it's giving our hospitals more time.
One more question from me, if you don't mind, Dr. Cody. Grocery stores, any form of mandate coming to them to wear the PPE?
So James Williams can provide more detail on this, but one of the, again, my overarching goal with this order is to ensure that everyone stays home to the greatest extent possible, and that when you do need to go out to perform an essential activity, that there are kind of guide rails in place to be most protective. And one of those is that businesses need to have a social distancing plan, and we've provided a template for that, so that there's some way to understand and organize social distancing within a place such as a grocery store.
Kevin?
So, to use an analogy, it's kind of felt like in the last couple of weeks that we're peeling off the Band-Aid slowly. If these restrictions are urgently necessary, why don't we just jump to doing the most severe things and enforcing it as stringently as possible now, rather than a gradual sort of tightening down on these restrictions?
Thank you for the question. So, as you note, I had orders, progressive orders during the month of March, with the biggest leap by far on March 16th, issuing the order to shelter in place. The updated order that I'm issuing today does a couple things. One is it extends it, acknowledging that we need to do this for longer, and it makes it more clear, so that it's easier for people to comply, and it will be more apparent for our enforcement partners what they need to do to ensure enforcement. I think that our order is about as strict as we can get, and still enable basic services, essential services to continue. People need to be, people need to eat, people need to access care, and essential services do need to continue.
Just a quick follow-up in terms of going to grocery stores. We kind of hear people expressing frustration with people taking advantage of the ability to go to a grocery store, getting a couple of items, going back in the afternoon, going day after day. Is there any discussion of perhaps implementing a system where you have a designated day, a Monday, a Wednesday, or a Friday, where your family base, perhaps on your alphabet, your last name, would go as a way to really clamp down on that? And also, is there any discussion of kind of codifying what kind of cleaning or protective gear the stores need to have?
Yes, we have codified much of what stores and essential businesses need to do when they're open and serving the public to be most protective. I want to highlight something that's very important. I want to ensure that people understand that the 6 feet, it's not as though you're within 6 feet and everything's fine. That's a minimum. That's a minimum. More is better, okay? More distance is better. Smaller groups are better. The less time you're in contact with others is better, right? There's a lot of dials that we can use to overall improve the protectiveness of the order.
Chess?
Just to be clear, mandatory social distancing, we're calling on all businesses that are not essential to close, and the ones that are essential to put in place protocols to make sure there's social distancing, et cetera. What is the enforcement mechanism for this? And maybe Jeff can
right. I mean, turn it over to some of my colleagues for that question.
So I can speak a bit to the enforcement piece and also a little bit more about the protocols. So one of the big changes in the order is to require essential businesses to complete, post, and implement social distancing protocols. There's a form that's attached to the order to help them do that. That includes things like sanitation measures, social distancing measures, and they need to tailor those to their specific facility rather than coming out with some kind of number that may or may not make sense for a specific facility, we are requiring those businesses to create a tailored social distancing protocol and plan for the specific facility that they will have that is open. By doing that and requiring that that protocol be posted, provided to employees, posted so it's available to the public, it is also available for folks who are carrying out enforcement so that they can then validate that there is adherence to those protocols that are facility specific. And so the intention is to craft a model that accounts for the fact that different stores have different physical configurations, that they operate in different ways, and that there are different kinds of services being provided in different facilities, but emphasize and reinforce the need for these social distancing practices to actually be implemented on the ground there. The order is enforceable by law enforcement. We did hear from the district attorney's office. They've been doing a phenomenal job with intake on various complaints and follow-up, working in partnership with local law enforcement. That is an effort that is continuing, but the vast majority of folks really are getting the message and they are adhering to the order. I'm going to piggyback off one thing Dr. Cody did mention. Just because something is open as an essential business doesn't mean that people should be out and about as much as possible. The reason those things are open isn't because it's necessarily a good idea to do those things, but it's because we need access to those services. And so people should be thoughtful about how often they're, for example, going to the grocery store, because every interaction does count, and there are lots of things we can do in our daily lives to try to minimize those, even when we do need to access essential services.
Quick follow-up, and then we'll take a couple more.
Clarification here. We talked to Chief Garcia. He has two health compliance teams. So is there anything beyond those two teams? The Sheriff's Department have teams that are driving around checking businesses and see if they're open or not. And when you talk about social distancing or people staying in their home, I guess where I'm leading with this is, are you going to have police going out and stopping people who are out, or groups of people who are congregated? I mean, is that what we're doing?
The enforcement has really been focused on the businesses, as the district attorney mentioned, and I think, turn it over to him to talk a bit more about what his office is doing in partnership with local law enforcement to make sure that people understand the order and are adhering to its requirements.
There is a hotline and a website that we've set up at the district attorney's office in conjunction with county council and the county, where residents can email, that's the best way, and say they see a business or a group of individuals that are violating the public health order. In the last week, we've received close to 2,000 complaints. We have a team of prosecutors, investigators that respond to all of those complaints. We triage them. As I want to emphasize, the vast majority of the businesses in our county are voluntarily complying with this. For the small number of businesses who aren't, a phone call from a district attorney investigator or a prosecutor in the DA's office often does the trick. If a phone call is not sufficient, then we'll send out one of our investigators in the DA's office, or we'll alert the local law enforcement in the city where the business is operating, and the police will go out and talk to the business owner. That takes care of many, many situations like that. For the small, very, very small number of individual businesses that still refuse to comply, there are two options that are a lot tougher. And one is to pull the business owner's license and to proceed administratively. That can be done very quickly and very efficiently. The second is to charge that business owner with a misdemeanor for violating the public health order. It's a misdemeanor that will obviously be heard in a couple months after this crisis has been averted, but it carries significant deterrent effects. Lastly, for businesses that are flagrantly violating, there's also unfair business practices, which lead to civil penalties and punitive damages. I want to emphasize that prosecution And pulling business licenses and punitive damages are last resorts. Our emphasis is on voluntary compliance, and we are getting voluntary compliance from the vast majority of business owners. I'm not surprised. This is a wonderful community. But for the small number that do not get the message the second, third, or fourth time, there will be consequences.
A couple more questions. A question here, and then we'll go on.
When it came to construction, that now it's all considered non-essential besides some exemptions. I just was going to say, it still said, I guess, can you go over what changes related to construction with this new order?
Sure. So the order does, the prior order did limit construction activity significantly. The new order tightens that restriction down. And really tries to focus on what construction is essential at this time. And so there are 8 categories that are still allowed. That includes projects that are immediately necessary for the maintenance, operation, or repair of essential infrastructure, projects associated with healthcare operations related to the COVID-19 response, obviously if we need to set up, for example, the FMS facility, affordable housing that is or will be income restricted with at least 10% income restricted units, public works projects, but only if specifically exempted by the governmental entity. So it's not just a blanket. Each governmental entity needs to actually look at the list of specific public works to validate that it's something that needs to move forward at this moment. Shelters and temporary housing, projects immediately necessary to provide services to, for example, the homeless or elderly or others who need access to other assistance at this time. Construction that's needed to wind down a site and leave it in a safe condition. And construction to repair residences or buildings containing essential businesses to keep them safe and habitable. So specific categories, much narrower. I know it's something that we've gotten a lot of questions about in the last few weeks. But really the focus for this and all the other changes and provisions in the order was really the health officer's collective judgment that the things that are exempted are things that need to happen now, and things that can be deferred or that may not come online for a long period of time are not things that need to happen right now in this moment when we need everybody to the greatest extent possible to stay at home.
So just to clarify that, so now like market rate housing projects, apartment complexes, those would be halted?
That's correct.
So we have 2 more questions, one here, and then we'll go back to the gentleman over there.
Yes. How does this new order relate to restrictions on takeout restaurants in general? Does this mean like you're discouraging people from going to takeout restaurants, or like wanting them to stay home more? I mean, you said limit how many times you can go out. So
the language with respect to restaurants is unchanged, meaning that takeout and delivery is still permissible, but dining in is prohibited. And so that language remains the same. Those businesses will still be required, just like grocery stores and others. Any essential business will have to fill out that social distancing protocol specific to their facility to document and implement steps in its facility to ensure social distancing and cleanliness and so forth. So that applies to all businesses.
One last question over there. I have a message for Dr. So the public may be wondering, what will your team need to see in terms of results in order to roll back the severity of the order?
I think what we need to see is that our demand curve, which is how many people are ill, requiring hospitalization and ICU care, comes to a place where it's comfortably nestled under our supply curve. What's the supply of beds, ICUs, necessary staff, and necessary equipment to care for them in the way that they need to be cared for. So it's a complex balance. I want to I want to say that bringing in the data to understand all of the needs in our healthcare system, be they supplies or beds or staff or personal protective equipment, is fairly complex, as is understanding the trajectory of the epidemic in our county. And so we're trying to bring all of that together to best understand and do everything we can to ensure that anyone who needs care for COVID or for something else gets that care.
We need to protect. Okay, one last question. We need to protect Dr. Cody's time.
Okay. Does the county plan to start releasing daily hospitalization numbers, cumulative?
Our overall goal is to provide as much data as we can, as granular as we can, as quickly as we can. So that's our top level goal. On the back end, it turns out it's pretty complicated. And the hospitalization data is particularly complicated. But we are going to do everything that we can to make sure that the public, I think it's also important for the public to see and understand what the data looks like so that the actions that we're taking and the sacrifices that they're making make sense. And that's our goal.
Thank you. Thank you for coming.
Can I have the mayor?
Thank you.
Can I have the mayor? Thank you.
You can follow up with him afterwards. Thank you. Thank you.
All right, you have been listening to a live news conference from the Santa Clara County health officials here, as well as elected leaders. Various bits of news made this morning, or this afternoon, I should say, with these folks. So first and foremost, the most important thing is that the stay-at-home order in Santa Clara County has now been extended until May 3rd. So it was set to expire, but now it has been extended until May 3rd. And in addition to that, the order that put that into place also does now include additional restrictions on businesses. And we're going to wrap all of that up this afternoon. We're going to have the news at 5, 6, and 7. For now, though, we're going to return you to our regularly scheduled program, and that's Access Daily.